This segment of Delmarva Life is brought to you by Tidal Health.
As you know, we are all about simplifying things here on Delmarva Life. And as Katie so kindly made me say before the break, today's topic is what I said just a moment ago. Listen, we're having a little bit of fun with this, but it actually is very important to discuss. And that's what we are doing this afternoon with Dr. Michael Bounds, who's a vascular surgeon with Tidal Health. Thank you so much for joining us.
Thanks for having me.
This afternoon. Okay, so let me ask you about the transcarotid, I knew I wasn't going to get this right, transcarotid artery revascularization, or TCAR, right?
That's right.
Okay, tell me real quick what that is.
So transcarotid artery revascularization, or TCAR, is a new method of treating carotid disease to prevent stroke. Carotid arteries are the arteries that go to your brain in your neck.
Right.
This is a way of placing a stent through a minimally invasive procedure to prevent stroke.
Okay, we're talking about cutting edge surgery here.
We are.
And this is not something that's new for Tidal Health.
So this is a new procedure over the last few years.
Okay.
One of the important points, I think, is that this is not an experimental procedure.
Right.
There's been thousands of these done around the country. It has the lowest complication rates of any procedure for treating carotid disease, and I think it's great that we're able to offer it here in Delmarva.
Can you kind of simplify what it is that's done?
So what we do, rather than making the traditional sort of large incision in the neck to
Right.
clean out plaque from the carotid artery or place a stent from the groin, what we do is make a small incision above the collarbone, treat the blood vessel in the neck with a balloon and a stent,
Okay.
and then use flow reversal, so reverse the flow of blood in the brain to catch all the debris and plaque while we're doing that procedure and put it through a filter and back into the blood through a vein in the leg.
Okay. So is there anything that makes one person a better potential patient for this than another?
So lots of patients are candidates based on their anatomy in their neck.
Okay.
One of the things that this procedure is great for is for patients that are too sick or have too much sort of prior surgery or radiation or other problems to undergo traditional surgery.
And Tidal Health is really going more towards the minimally invasive approach, right?
That's true. Yeah, we're offering things these days that 15 or 20 years ago wouldn't have even been an option for most patients.
So why is minimally invasive so much better?
So most patients that have these procedures, so for instance TCAR, leave the hospital the next day after undergoing the procedure. We're doing aortic surgery now where patients used to have incisions from their chest all the way through their belly and spend a week or more in the hospital. Now they're going home the next day.
Oh my goodness. So how large of a surgical team do you need to be able to actually do something like this?
So I think it's important that, these days in surgery, it's not just a surgeon in an operating room.
Yeah.
We're a team.
Right.
The anesthesiologists play a very important role in these procedures, managing the patient's blood pressure and heart rate during the procedure. We also have radiology staff, OR staff, nursing staff all available in the operating room that have had extensive training sort of going into these procedures before we do them.
And it's turning out well for the patient.
It's great. I mean, patients wake up quicker, the procedures are faster, patients leave the hospital feeling pretty well, walking out of the hospital the next day.
That's nice. So when it comes to heart care, how does it make you feel working for an organization who is so willing to get to the cutting edge to do the best for the patient?
So I think it's great. I grew up right here in Salisbury, did my training throughout the Southeast, and it's been really interesting to come back here. I'm relatively new back to Salisbury this year, and see how much we're able to achieve right here at home.
Right. Well, I'll tell you what, Dr. Michael Bounds with Tidal Health, we're glad to have you back. Thank you so much for talking to us this afternoon.
Thank you.